His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. I remember it was late, deep into the kind of late where the vending machine in the break room becomes your closest friend, and the hallway smells like floor cleaner and something faintly floral that nobody can quite explain. I was covering the tail end of a shift that wasn't even mine. My colleague had called in sick, and I'd said yes before I even understood the question, because that's just what you do when you're young and still believe that sleep is optional. The patient's name was Marcus. He was somewhere in his mid-30s, I'd guess, the kind of man who looked like he fixed things for a living. Broad shoulders, careful eyes, calluses on his palms that told their own story. He was sitting on the edge of the exam table with his arms crossed, which is always a sign. Arms crossed means, I don't want to be here. Arms crossed means, I am holding myself together with my own two hands, and I would appreciate it if you did not disturb the arrangement. I pulled up a stool, sat down instead of standing. That matters. When you sit, you take yourself out of the position of authority, and suddenly you're just two people in a room together, figuring something out. So, I said, who told you needles were going to be involved tonight? He looked at me like I'd asked something in a foreign language. Then, slowly, the corner of his mouth moved. The intake form, he said. It was pretty specific. Ah, I nodded seriously. Those forms, very dramatic. He laughed, just once, just a short breath of a laugh, but it was enough. His shoulders dropped maybe half an inch. That half an inch is everything. Here's what nobody tells you about giving injections. The actual technical part takes seconds, literally seconds. What takes time is everything that surrounds it. The approach, the conversation, the careful work of making someone feel safe enough to unclench. Marcus had come in for a vitamin B12 injection. His doctor had ordered a series of them after some blood work came back showing a deficiency. He'd been feeling exhausted for months, the kind of tired that sleep doesn't fix, the kind that sits behind your eyes and makes the world feel slightly underwater. B12 deficiency can do that. It sneaks up on you. People assume they're just stressed, or not sleeping well, or getting older faster than expected. But sometimes it's simpler than that. Sometimes your body just isn't absorbing what it needs from food, and a little help from a needle fixes months of fog. I explained this to him while I was setting up. I've found that giving people information while you work keeps their attention on their brain and away from their arm, which is where you actually need them not to focus. The injection goes into the muscle, I told him, snapping on my gloves. There's something about that sound, the clean snap of latex, that always makes me feel like I'm stepping into a role I know well. Deltoid usually, that's the upper arm. Or sometimes the gluteal muscle if the volume is larger. But for this, we'll keep it simple. Simple, he repeated, like he was trying the word out. Simple, I confirmed. You're going to feel a little pressure, maybe a brief sting, and then it's done and you can go home and sleep for approximately 1,000 hours. He rolled up his sleeve. His arm was warm. I noticed that when I rested 2 fingers against the skin to locate the muscle, which is what you do. You feel for the deltoid, find the triangle of muscle between the shoulder and the elbow, stay in the upper outer portion. That placement matters. Too high, too close to the shoulder joint, and you risk the bursa. Too low, and you're near the radial nerve, and that's a conversation nobody wants to have. The middle third of the muscle is your target, always. I cleaned the site with an alcohol swab and let it dry. That part people rush, and they shouldn't. Wet alcohol on a needle track stings more than it needs to. Take a breath in, I said quietly. He did. And let it go. The needle went in at about a 90-degree angle, quick, decisive, because hesitation is what causes pain, not speed. A slow, uncertain needle is worse than a fast, confident one. I always tell my students that. Be the needle you wish to receive. They think it's funny. I'm only half joking. I drew back the plunger slightly, just a fraction, to check that I hadn't hit a vessel. Clear. Good. Then I depressed the plunger slowly, steadily, letting the solution move into the muscle at a pace it could accept. He didn't flinch, not once. I withdrew the needle in one smooth motion, pressed a small piece of gauze to the site, not rubbing, just holding, because rubbing can irritate the tissue, and looked up at him. He was staring at his arm like it had done something unexpected. "That's it?" he said. "That's it." He was quiet for a moment. Then, "I've been dreading that for 3 days." I peeled off my gloves and set them aside. 3 days of dread for 7 seconds of needle. That's a pretty unfavorable exchange rate. "Yeah," he said, and he was smiling now, a real one, the kind that reaches the eyes. "Yeah, it really is." We talked for a few more minutes while I documented the injection. Time, site, lot number, his response. I mentioned that he should watch for any unusual soreness at the site over the next day or so, which is normal, and that some people feel a mild flush of warmth or energy shortly after a B12 shot, which is also normal and actually kind of pleasant if you're prepared for it. I told him to stay hydrated because it helps the body process the injection more smoothly, and to keep his follow-up appointments for the rest of the series. One shot rarely does the whole job. It's the accumulation that matters. Before he left, he paused at the door, turned back. "Is it weird that I feel better already?" "Probably psychosomatic," I said. "But psychosomatic is still better. So." He laughed again, longer this time, and then he was gone, and the hallway was quiet. And I sat there for a moment in the particular stillness that follows a good interaction. There's a version of this job that's just logistics, schedules and charts and the correct way to dispose of sharps, and all of that matters genuinely. But underneath it, there's something else, something I couldn't have named when I was in school, something I only learned by doing it, by sitting down instead of standing, by asking the dumb joke at the right moment, by letting my hands be steady so someone else's hands could shake. Care is a kind of conversation, and sometimes the most important thing you can say is nothing at all, just the warmth of a gloved hand finding the right spot, and the quiet certainty that you know what you're doing, and so everything is going to be fine. I turned off the light in the exam room and went back to the break room. The vending machine was still there, waiting. Some things you can count on.